seen many technologies come and go, and now I'm really discerning, and I only pick the things that I really love for my patients, and the things that I really want to have for myself. And I was discussing this with a person the other day, and the journey I followed in my career has really been through anti-aging, perimenopause, and things that I feel that will help me and people like me, and obviously my patients. My conflicts of interest are on the screen. So I just wanted to ask you, how many people here treat patients or clients? Come on guys, how many people here, show of hands, treat other people? Okay, awesome. And how many of you treat faces? Okay. And how many of you treat bodies already in practice? Or body sculpting? So about half of those. For those of us who are not doing that, we already have an inbuilt database, and when we only treat faces, we're literally missing half the picture. Because if you look at these patients, that's what they're going to want. Now, we're in aesthetics. Aesthetics also comes into play with wellness, and yes, it's about looking good, but our patients, they want to feel good all the time. And if I asked you to look at the pictures on the screen, and I asked for a show of hands as to which person looks the healthiest, not the best, but the healthiest, would you pick number 5? No, right? You might not even pick number 1. Somewhere around number 2 would probably look like the healthiest person. And interestingly, the statistics are that Real Self, who did an aesthetic interest survey in 2018, said that just over 3 in 4 UK adults want to change at least one part of their body. That's 3 in 4 people that we know want to change one thing about themselves body-wise. Also, interesting statistics. Since we've come out of the pandemic, there's been a 77% rise in non-invasive body contouring treatments, according to the American Society of Aesthetic Plastic Surgeons, the report which compared 2022 to 2019. There wasn't a 2020 and 21 report, obviously, with COVID, but that's a massive jump, 77%. So those of us who have a database, who look after patients, who treat the face, we're definitely missing out if we're not treating the patient as a whole and treating their body. Not only do they want to look good, but they want to feel good as well. And then it's not just about patients of normal size. I mean, the global obesity epidemic is huge. The statistics, I've got them on screen so I won't read them, but if you think about it, obesity has nearly tripled since 1975. That is huge. So there's a whole cohort of patients we're not able to treat in our clinics with the current treatments that we have, because none of them are licensed for patients who are obese. What are the solutions for body contouring and body treatments? So first of all, we've got body contouring, and these can be broken down into 2 separate treatments, the cold treatments and the heat treatments. And yes, they all work. Some of them work better than others, some of them have more complications than others. And in my practice, I still do cryolipolysis, and I do a significant amount of it. But that is for one specific indication, and that is for contouring or changing the shape of a body. There's muscle stimulation, which helps grow muscles, which again we still do in my clinic. And then there's global fat reduction. How are you going to make the whole of you look and feel more healthy? We've got incretin mimetics, which are things like liraglutide and semaglutide, which people are using to help themselves lose weight and increase your insulin sensitivity. But what people don't want is the side effects. And also, it's a prescription-only medicine. And on top of that, can we actually get them in the UK at the moment? Because definitely, most of the patients I know can't get their hands on it. So what's our other option? And the other option for the global treatment of fat is non-thermal laser, which works by photobiomodulation or works on photochemistry. So I just thought the problem that you noticed, because photochemistry is something that was relatively new to me when I started hearing about this, not too long ago, like a couple of years ago. But basically, it's when electron excitation results in a change in your cellular function by breaking or reforming bonds or setting off a chain cascade. And actually, when I first saw this, and I saw the machine, and I didn't put a video on the presentation, but if you've had a chance to go to the stand and you've seen it, mumbo jumbo, right? It looks like there's a light just shining over your body, not doing very much. There's no contact. It's really dignified treatment. You don't really have to get completely undressed. And it's really comfortable. So how is this doing anything? And when I thought about it, I thought, actually, can this really be doing something? I thought back, and I thought, well, if sunlight can excite electrons in, in chlorophyll in a leaf, then, and that is the whole process by which the energy is made, and the sun's energy is harnessed and stored, then why, in chlorophyll, then why can't we do this in our body? And actually, what the laser does is actually improves the process of cytochrome C oxidase, which is actually sometimes a very limiting step in our mitochondria. It's the end result of phosphorylation in our mitochondria. So that's how the emerald laser actually works. And the beautiful properties of emerald laser are that it's non-invasive. It's actually forget non-invasive, it's non-contact, which is amazing. There's no downtime, there's no pain. It optimizes your mitochondrial function. It's anti-inflammatory. We know that a large part of aging is due to inflammation. It's got so many good benefits. But the ones I use in my practice are fat loss and cellulite reduction. But that's not just what my patients see. What my patients see are the fact that they do feel full of energy. They feel, revitalized. They look forward to the treatments. And actually, it's changed my practice in a way that not only am I able to do treatments that really reflect what my patients want, so they want to feel healthier, they might want to reduce fat, but they want to feel more full of energy, they want anti-inflammatory, they want all these treatments, and it's actually not just my patients, it's my staff. I cannot believe the difference it has made for the staff in general. And they're actually coming in an hour ahead of schedule to come and get these treatments. And if you don't believe me, my head of ops is here, you can ask her about the treatment, and she will tell you how she feels about it. So what's the solution here? It really is non-thermal laser. It's the only technology that's not only been FDA approved for overall body circumference reduction in people of normal size, but also in the obese patients that we see that we have real difficulty in treating. No downtime, no side effects, and no pain. I mean, that's quite massive. So, the other thing I wanted to discuss was the fact that we almost see body fat as a problem or a bad word, right? That, oh my God. But actually, we know that the fat is actually part of our endocrine system, and it's a really important function for the body fat. And we know that it's got energy storage and release, insulation, but actually, it maintains insulin sensitivity, it regulates glucose, and it's got loads and loads of endocrine functions in the body, especially metabolizing sex hormones as well. So it's really important that we maintain healthy body fat. So when we have treatments where we're destroying small amounts of body fat, that might be okay, but when we're destroying large amounts of body fat with serious amounts of apoptosis, by some of those body contouring treatments that we talked about, or even liposuction, when we're removing the fat cells altogether, we're actually disrupting the fact that this body fat does have important regulatory functions. And what I really like about non-thermal laser, the emerald laser, is that it optimizes how our fat cells work. So what it does is it doesn't destroy any of our healthy fat cells. What it does is to help the hypertrophied fat cells, all the fat cells that aren't working properly, the emerald laser will help to bring those in line and bring them back to becoming normal, healthy fat cells, so that they are now anti-inflammatory and not pro-inflammatory, and it helps to regain our energy balance. So that's all really good in theory, right? But what's the research behind this? So 21 years ago, Dr. Nira, surgeon, was conducting some studies, and he was using these lasers for pain relief, but he was using them sort of pre-treatment. And what he found was that if you look at the pictures, the pre-treated fat that came out when he did the liposuction is actually more emulsified than the fat that hasn't been treated before. And non-thermal energy is having an effect on the fat. So some testing was done, so some in vitro testing was done first, and that showed that with non-thermal energy, the fat emulsified, it actually left the fat cell, and it came out of pores in the membrane. But we didn't know that yet. And then, again, this was studied in greater depth, and there are multiple papers on this. And one of the reasons I like non-thermal laser, especially Emerald, is that it's got so much research behind it. And when you read the papers, they're really robust. It's got the right clearances for the right things. And what this paper showed, I'm going to show you the next slide, it's got really great pictures on it. So this is scanning the electron microscope. So you can see the adipocytes on the picture on your left. And at 4 minutes, it shows that 80% of fat within the adipocytes is actually liquefied and had left the fat cells through like a transitory pore that's created in the cell membrane. And by 6 minutes, about 100% of that fat has emulsified. Now, obviously, we need to do something with that fat. We need to burn it or use it, otherwise it kind of just stays back inside. So that's what the EM showed. So I think I've talked over this already. But any of the fat that is liquefied and leaves the cell can be transported to the lymph vessels and then broken down by macrophages and then obviously processed through the liver. So if we recap on the whole process, hypertrophy adipocytes are the only ones that are affected because they're sort of dysfunctional in how they behave. And the non-thermal laser will cause these small, tiny, transitory pores which are open for about 48 to 72 hours. They let this emulsified fat leak out, and then the emulsified fat is then transported to the lymph vessels and then cleared up by macrophages. And that is how this non-thermal energy works, and that's how Emerald laser gives us this global fat reduction and makes us feel full of energy. So those non-esterified fatty acids or free fatty acids are then available for us to fuel our bodies, to fuel our muscles and our organs, and give us a big boost of energy. So further research was done on this in 4 separate research trial sites, and it was a double-blind, placebo-controlled, randomized, multi-center trial. And what it showed is that in patients of a BMI up to 30, that just 6 treatments of something that is non-invasive, non-contact actually, no downtime, and no side effects, was giving us a reduction of up to 4.5 inches. So when I looked at this first, I thought it was centimeters, I thought, well, that's not very much. But 4.5 inches is quite a lot. So they're American studies. And 4.5 inches in the BMI of up to 30 is great, but then does it work for obese people? So a BMI of a fat reduction of 4.5 inches is actually approximately 5 pounds or 2.5 kilos of actual fat by liposuction. So that's quite marked if you think about it, for 6 sessions, no downtime, no contact, and no side effects. So does it work on obese people? Let's have a look. Another study was conducted for BMIs between 30 to 40. And what this showed was that patients who were of a BMI between 30 to 40, so obese, severely obese, actually had even more reduction globally. These measurements were done around the midsection. So yeah, absolutely, which works. It works for that sort of midsection circumferential reduction. And don't forget, it makes you feel full of energy, which means you can do more and work out. But does it only work on abdomen? Does it only work in the midsection? The answer is no. There have been studies done on the upper arm, on the double chin, and I promise you I'm not going to bore you to death and share all the studies with you, but they are available if you want them. So okay, we know how it works, we know that it does work, but is it safe? Emerald laser has lots of safety studies behind it, and safety studies show that there is no change in serum lipids when you have emerald treatment, so it's not like the fat is going to damage you or go anywhere else. So that's how we know that, and that's been published again. So the importance of the emerald laser is about preserving the fat rather than destroying it. It's about making sure that we maintain healthy body fat, that we're not destroying too much particles, we're not destroying any with the emerald laser, so that we can maintain all of the body fat functions. It's also only the beginning. Non-thermal laser is such a fascinating field for me. And the nice thing about it is that we can do a holistic view for the patient. Not only do we treat their body fat, we treat their energy, we treat inflammation. Different non-thermal lasers we treat pain as well. One big plus point is that it gives quicker recovery. So post-surgically, even post-treatments that we do in terms of other body contouring treatments or other, so that when I do resurfacing for crepey skin on abdomens and you want to heal the patient, it's brilliant. Just stick people under the emerald laser and the healing speeds up because of the rapid self-work. I've said about the anti-inflammatory, I cannot stress that enough. It's got 21 of the 24 US clearances given to low-level lasers as the emerald laser, and that's why we love it. It's all scientifically backed up with research studies. It's non-invasive, it's not painful, no bruising, no swelling, no downtime, no apoptosis, so we're not damaging any fat cells. And unlike some of the other treatments that we have, and I still do cool sculpting for cryolipolysis in my clinic, because I think there is a place for it, but there are no proved side effects with emerald laser. So we give you a global reduction. No changes in blood chemistry, and due to the increase in ATP, my patients and my staff feel like they've got a whole load more energy, speeding up the mitochondria. And that's why I have to say I really love it. I try and combine it with all my treatments. And for a treatment where it's really dignified and it's non-contact, there's nothing horrible about it. And if you're here today and tomorrow, I would really encourage you, if you haven't seen it, go to the stand and have a go. It is absolutely phenomenal. All you feel sometimes a little bit of a tingle, and it does feel like mumbo jumbo, but the way you feel afterwards definitely will let me know how the patients feel. So the clinical results, these are not mine, but these are some of the results that I saw before I purchased the laser device itself. So this is 5, I don't know why it's 5 treatments and not 6 treatments, but each treatment is 30 minutes where the patient lies down. It's a full circumferential treatment, 15 minutes on one side, so on the front, 15 minutes on the back, and you get the full circumferential treatment. You don't need a therapist in the room the whole time. It's the easiest treatment to do. Literally lie there, position, press the button, 15 minutes later, turn over, and cook again. You really don't have to mess around, so it's really consistent energy delivery. But this one has a reduction in fat, improvement in cellulite, and even an improvement in skin texture. Again, this was one of the patients that I saw. That's a really nice result, right? Something that's no contact and no downtime. And actually, my patients are coming to the clinic over and over because they actually think it's their me time. They actually relax into it, and they feel like it's not a treatment that's arduous, it's their own special me time. These are my patients coming up, and we've got a lead your way to show for education, but please don't take photographs. Oh, not this one yet. This is just to show you that as well as abdomens, we can do under the chin. We can do arms. We can do, I've got really nice cellulite one coming. But this is my patient. Does anyone want to see that again? Yeah? Okay. There you go. So this patient is late 30s. I'll do it for now. She suffers from MS. It's quite progressed, and she can't exercise. I know she hasn't changed her diet, and she hasn't changed her lifestyle. She's had 6 sessions of the emerald laser. She has had lymphatic drainage as well for 3 sessions. And when she saw her results, she said, I feel full of energy. I've got fully only one, and I feel so much more full of energy. She's already got her 2nd course. So it really is a treatment that patients love and sells itself. Okay, so this is a gentleman, typical 50-year-old gentleman. There you go, so that's the before and after. And I'm going to show you another picture of him, just so you you can see, those arrows are exactly the same size. Because what I hate is people who shrink the after picture. So all of mine I put on top of each other and make sure that they're all the same size. And this is the same patient, but I just wanted to show you from a different angle. If you have a look, the arrows on the chest are exactly the same size. So in fact, after maybe slightly bigger, and I've done that on purpose. But you can see that his whole contour has changed. He's also lost his tan, but it's not that. My patients look yellow in the picture before because we changed our photography area, so I do apologise for that. But you can see that he's actually had a really nice circumferential reduction where he needed it. And my last before and after I'm going to share with you. Again, I can replay that. Anyone want me to replay it? Ready? Now that has to be one of my favourite before and after pictures I've had in my clinic at all time. So this wasn't 6 sessions. Can't click to the next one. There we go. This was actually 10 sessions of treatment. And he was one of our first patients onto the treatment. And this is the kind of results that we can generate with no side effects, no downtime. Patients love it because they feel great. My staff love it because it's an easy treatment to do. My staff love it because they love to have the treatments themselves. And that is why I love emerald laser. Oh. And I said it doesn't only do abdomens, right? This is a cellulite treatment. I did do it with RF for lymphatic drainage as well. As we know, cellulite is a condition which is really difficult to treat. And unfortunately, it's a condition that's ongoing. So just 6 sessions or 10 sessions won't be enough. People have to do maintenance and keep coming back. But these are the reasons that at Skin Medical we love emerald. Thank you for listening. Do we have any questions? Have we got time for questions? Yay!
Yes, thank you very much. It was great. What are the mechanisms behind the improvement of cellulite? Because I understand the concept of the pore, the temporary pore, the open and the fat cell and stuff, but why is this effective against cellulite? What is the intimate mechanism in your opinion?
So we know that cellulite is because of the fibrous bands that run perpendicular. So think of, you're driving horizontal, the bands are perpendicular. So yes, we haven't done any incisions or blood dissection of the band at all, no. For that particular patient, she didn't want anything invasive like that. That works beautifully. But what we have done for her was shrink the fat cells that were in those pockets, because the fibrous bands obviously have a finite number of fat cells in them. And those are lymphocytes. As we put on weight and a little bit unhealthy, they grow and sort of become hypertrophy and they bulge out of those pockets. But when we shrink those back down, the appearance of the cellulite improves. So were she to gain weight, or she goes to put on weight again, yes, the cellulite will come back. If she maintains healthy lifestyle and continues her treatments, we should be able to keep her happy on it.
Amazing, thank you.
Pleasure.
Thank you very much, Nicole. I wanted to also ask, if a patient was to go through the treatment and they had successful results, how long can we expect those results to last if they did, keep up a healthy sort of lifestyle following that as well?
Okay, so did everyone hear the question? Awesome. So that's almost like how long is a piece of string, because it really does depend on their age, their lifestyle, and what they're up to. But I'd say to my patients, circa 3 to 4 months, maybe not. We do recommend maintenance treatments, but what you'll find is if you have it in the clinic, because patients get a buzz out of it, they will want to come back and have it. And if you haven't tried it, I would highly recommend that you do. Have it, because you'll know that kind of buzz that I'm talking about. Because if you're doing it, oh my God, this is such a waste of time. I mean, absolutely nothing happening. But it's not until afterwards that really kicks in. And they'll want to come in because it's me time, it's lymphatic drainage. But if they don't, I anticipate I'd see them in my clinic at about 4 to 6 months with them going, oh, I've started to put on a bit more again. But again, if they were in the gym and keeping healthy, then that may not happen. And once they're in the sort of size and shape they want, if they really keep at it and and they have that healthy diet lifestyle, then they never need to come in.
Okay, thank you.
Any more questions? In which case, I'm going to say let's all go to the Erchonia stand, because we've got a DJ and it's right next to the networking. Thank you for listening.